Welcome to the Rich Carroll program. I am your host, Rich Carroll. I want to thank you guys for tuning in today. We're going to be talking about a bill that was recently introduced in the Senate, and it was a bill introduced by Senator Bernie Sanders of Vermont. You can probably guess what it is, but the bill introduced would enact a single-payer healthcare system here in the United States of America. So I started doing some reading to see what I could find, try and get some details on the plan, and I came across a piece from The Atlantic. Here's what they said would be in the bill. The measure would first set up a national health insurance program that would be administered by the federal government. Everything from primary care to hospital stays would be covered under the plan, and without a requirement of out-of-pocket spending on deductibles and co-payments. This plan would also include abortions. It would effectively overturn the Hyde Amendment. Now, the Hyde Amendment says basically that federal tax dollars cannot go to providing abortions. And patients could use private insurance still to cover services deemed not medically necessary. For instance, plastic surgery. So, as I began to learn a little bit more about this, I found it kind of interesting. I found it interesting that in a recent poll from the Kaiser Family Foundation, that 55% of people polled supported a single-payer healthcare system. Now, that same poll found that support began to drop when people find out that government will be in charge of healthcare and they would have to raise taxes on Americans to pay for the plan. What would some of the costs be associated with the single-payer system? Well, you can get sort of an idea by looking at some states that have tried it. Believe it or not, Colorado has tried. They voted on it and it did not pass. The measure failed. Vermont was going to implement a single-payer system, but that too also failed. And the most recent one that I want to focus on was the state of California. California had a single-payer plan that was in the legislature that was projected to cost around $400 billion. So to give some perspective on how much that would be in context to California, the entire state budget of California is $179 billion. So single-payer costs alone would be double what the entire state budget is of California. Now, California would receive $200 billion in funding from the federal government. However, that leaves them on the hook to pay for the other $200 billion. So the Daily Caller, they started running the numbers, and here's what they found. A $200 billion increase on Californians would require a 15% payroll tax increase on top of the 15.3% they are already taxed. So you're looking at 30% of your check is going to the state to pay for single-payer healthcare and the state budget. Now, something in me thinks that there are probably still Democrats who like to keep the money that they have worked for. Needless to say, that bill was put on the shelf for a later date. Now, what would it look like if we were to enact, as far as costs go, what would it look like on a national level, like what Senator Sanders wants to implement? Well, the costs, they vary, actually. The Wall Street Journal has a lower projection. They estimate that it would cost $18 trillion over 10 years to pay for single payer here in the U.S. The Urban Institute, which is a little bit more, they have a higher projection. They think that it would cost $32 trillion over 9 years to pay for single payer. Did I mention that the national debt just crossed $20 trillion? So I don't know if we would exactly be able to pay for something like that. But in spite of all this information, here's the most interesting part. In 1987, the mayor of Burlington, Vermont, predicted that without a different funding system, a Canadian-style Medicaid for all healthcare system would, quote, bankrupt the nation. He said specifically, quote, but I think what we understand is that unless we change the funding system and the control mechanism in this country to do that, for example, if we expanded Medicaid to everybody, give everybody a Medicaid card, we would be spending such an astronomical sum of money that we would bankrupt the nation. The mayor of Burlington, Vermont in 1987 was Mayor Bernie Sanders. So even by Bernie Sanders' own admission, enacting a single-payer system would be a very expensive endeavor. So what do we do about lowering healthcare and health insurance costs and giving more people access to those things? Well, I believe there is a way to do that, and it's called the free market system. Because when companies have to compete for your business, prices go down. I mean, that's just the way the free market works. And I have included in my sources section 3 particular stories that address some free market reforms to help lower healthcare costs and health insurance costs. One story is in Politico, and it includes some ideas from Senator Ted Cruz on how to lower costs. Another is from Fox Business on a plan that Senator Rand Paul introduced earlier this year. And Senator Cruz and Paul, they actually they have some of the same ideas regarding the issue, so that might be worth checking out. And a third article comes from Reason Magazine, and that addresses ways that we can lower pharmaceutical prices, which is, I know, something that especially Democrats, they really care about. I've paid for various prescriptions too. We need to lower prescription costs, and that article by Reason, it gives some free market solutions on how we can get those costs down. I believe that we should try a true free market healthcare system and remind the American people that free market does still work here in America. Because right now we don't really have a true free market system when it comes to the healthcare industry. And as long as we keep electing the same old establishment politicians, John McCain, Mitch McConnell, Lindsey Graham, Paul Ryan, as long as we keep electing these guys, we will never see a true free market system here in the U.S. Guys, I'm Rich Carroll. I want to thank you once again for joining me. God bless.